Good afternoon and welcome everybody. Welcome to this media briefing. We welcome everybody, bailiwick residents, anybody listening beyond as well. Now, it is no secret that the Civil Contingencies Authority met earlier this week, and we considered very, very carefully the proposals that are going to operate from the 1st of July, which is now just a few days away. And I emphasise we considered it very carefully. We listened to the views of everybody. We appreciate the views of everybody in the bailiwick, and there are different views, and we've taken all those into account. But the advice we've had from STAC and from Public Health and from our own considerations is that we should still continue with the proposals to open a blue channel from the 1st of July, which means that people who are double vaccinated plus the 14 days will be able to travel without testing if they come from or are from the common travel area. The common travel area is England, Wales, Scotland, Northern Ireland, Ireland, Jersey and the Isle of Man. Now, the variation that we've made to that is that there will be testing for 12 to 17-year-olds. The proposed details and the details will be published on our website, so please, please, please refer to the website. Now, we fully appreciate that the steps we're going to take in just a few days is the biggest step that's been taken since COVID first visited itself upon the shores of the bailiwick and elsewhere in March of last year. And some people naturally have concerns. We fully appreciate that. And our job, our paramount concern, is to protect the interests in the widest sense of everybody, from the eldest of our population to the newborn babes. And we've taken that into consideration. And that will always be, because our decisions will always be reviewed in the light of changing evidence and circumstances, our paramount and overwhelming consideration. Now, as you can see, I have 4 other members of the panel, and I'm particularly grateful to them because all 4 of these people have been involved with COVID since February, March of last year. I'm a late arriver. I came upon as chair of the Civil Contingency Authority partway through October. I have valued in the last 8 or 9 months the contributions of these 4 people significantly, and I'm very grateful for them. And I've valued them as a citizen of the bailiwick ever since this COVID crisis has arisen. So, but in relation to that, we've got to sadly accept that COVID will be with us for a long time. It is not going to go away. We hope it progresses in the right way from being a pandemic to an endemic virus. But in connection with that, we have to accept that there will be clusters of cases. There will be outbreaks in the bailiwick of COVID. We cannot and will not be able to exclude cases of COVID coming into our community. But we have to live responsibly with COVID. We have to be vigilant. We have to report any symptoms that I have. We have to deal with each other in a proper way. Now, we have to have regard to all of that going forward. That is not going to go away. But remember, we wouldn't be taking the steps that we intend to take next week unless we believe they would work, unless we believe that we could cope, unless we believe that the facilities were there to be able to deal with them. And remember, in the autumn of last year, we did have an outbreak, a cluster of cases, which because of contact testing and tracing, we were able to deal with. And life went on as normal. But it is a big step next week, and we fully accept it. Now, Dr. Raby will be speaking to you about the hospital. Now, the hospital will be able to cope and what steps we've made. Dr. Brink will tell you about what further research has been done, where we're going to go with that. And Mr. Whitfield, our Chief Executive, will be telling you about the steps that businesses and people have to take post next week. Now, none of this is easy. We don't pretend it is, but we wouldn't be sitting here today telling you what our position was if we believed it was in the adverse interests of our community. The best interests of our community, we have to look at the wider interests of the whole of community, is that we move forward. We cannot be in lockdown forever. We're not taking a precipitous step. We're not being over aggressive. We're not being over liberal. We're doing what we believe is best. Now, what I'm going to hand over now and initially to is my able colleague who's been former President of Health, has been part and parcel of the Civil Contingency Authority since it started last March, Deputy Salisbury.
Thank you, Deputy Fairbrush. Now, the last 15 months have been like no other. Our world has turned upside down since Dr. Brink, the then Chief Minister, and I sat here and announced restrictions to our community, the like of which hadn't been seen since the occupation. These restrictions were never meant to be a new normal. They're always intended as extraordinary but temporary measures, taking into account the risks the virus presented to us. Throughout this time, we've constantly challenged ourselves and asked the questions: are these measures justified? Do the benefits of restricting travel outweigh the disadvantages? The answer for much of the pandemic, when we really had no other options, was yes. But we've known and have said for a long time now that the vaccination programme would be the game changer. Saying all that, it's not an easy decision, and it's one that needs to be made on the best available scientific evidence and expertise at the time. Since day one of this pandemic, you have trusted us, the politicians on the CCA, and we have trusted our experts who have proven themselves to be world-class, and they have sourced and trusted the best available data and evidence. That is what has got us as a community through this pandemic more successfully than pretty much anywhere else in the world. Nothing has changed. That's what we're doing again, and it's what we're asking you to do again. Trust us and trust our experts. Yes, of course, new data comes in, things do change, and that's always been the case, and we've always been open with you about that. But even then, we make decisions based on the best advice we get on the latest, best quality data. That's what we are doing once again. Yes, it's comforting that here in Guernsey right now, we only have a few positive cases, all of whom were picked up through travel. We have no known cases of community seeding. For some, that is all that matters, and long may that continue, I hear them say. And I get that, I really do. But the truth is, even if we never relaxed our border restrictions, it would not continue. We really can't keep the virus at bay forever. We have seen that we can't. The virus will not go away. It is on the planet for years to come. Our current policy will not prevent cases from arriving. If we think we can keep the virus away, then we're no better than King Canute trying to hold back the tide. And there are no certainties in any of this, and we've always known we can only mitigate rather than eliminate risk. We've assessed the risks and put in our best mitigations based on the evidence right back to those very early days in March last year. That approach has determined why we had 2 lockdowns in March 2020 and January this year, but when we had a cluster of cases in September last year, we didn't do so. That approach also led to restrictions at our borders, which have varied in their severity based on the changing assessment of risk. At all times, we followed the requirement that the CCA has under the law to ensure that its actions are appropriate and proportionate. That includes not only considering the impact of the virus directly on our community, but the impact of our restrictions on islanders, their mental health, their jobs, their freedoms. That's what has made it really difficult. It's not, and never has been, just about the virus. Some think we're moving too early, and if they were in charge, they'd leave it a few weeks or months. Of course, that's easy to say when you're not the one making a decision. If you're right, no one will care. If we're wrong, well, it's all about I told you so. But the truth is, opening now or in 2 weeks' time or the middle of August won't make much difference in terms of risk. It won't change what life looks like when we start to live responsibly with COVID. We really are at the stage where we're putting off the inevitable for no benefit at all. We said that if we kept on course with our vaccination levels, we would be ready by the 1st of July. We have done that thanks to the amazing community effort, and we're ready. No, our children and young people have not been vaccinated, but the evidence is clear and the risk of them getting very ill with the virus is really low. I'm a mum, and many of us here have either children or grandchildren who we love dearly, and we wouldn't be doing this if we thought we were putting them at an unacceptable risk. Now, Dr. Brink and Mr. Whitfield and I have been involved in this from the very start. We've lived this every day since then, as have many others who have got us to where we are today. There have been many sleepless nights, many meetings, and some very difficult decisions over those last 500 plus days. Everyone has worked so hard for so long. Neither us here or the whole teams of people behind the scenes who have invested so much time and effort over the last 15 months into protecting our community want to throw any of that away. I've trusted their judgment throughout, and I trust them today. Yes, this is a political decision, as has been every other since this started. But this next step is a recommendation of, and consequently has the full support of, Dr. Brink, the Scientific and Technical Advisory Cell, and Dr. Raby, who are unanimous in saying that the probability of a third lockdown is very low, and now is the right time to move forward. I know this feels like a big change, and in one sense it is, after 15 months in the relative safety of a bailiwick bubble. But in another sense, it's no change at all. We're doing what we've always done, trusting the experts and trusting the evidence. Next Thursday will be a new dawn for us all, but it is one where we should not be afraid of the light.
Thank you very much indeed, Deputy Salisbury. And as you say, we're following the recommendations of our advisors who are following the evidence, and that's the appropriate point to hand over to Dr. Brink.
Thank you very much. And just to echo Deputy Salisbury and Deputy Fairbrush's point, is this is an incredibly difficult decision, and moving on will always make some people fearful, but what we're trying to do is look at the health and well-being across islanders, so not only at the very narrow risk posed to us by COVID-19, but the broader health and well-being, which we know has been adversely affected by the pandemic. So it's time to look at the whole island health. But if we look at the situation in the UK, and you can see it now, is you can see the situation has deteriorated there, with much of the all of the north of England, bar the Scottish Islands, going into the red zone, the south of England being category 3, with some of that worsening as well. But what is very interesting is with this wave of infection in the UK, you haven't seen a similar level of hospitalisation to what you saw in December, January last year. And I think that has been encouraging for them. And if we go on then specifically to look at the greatest armoury, greatest tool that we have against the virus at the moment, it's our vaccination programme. And again, I'd like to pay testament to islanders who have engaged with the programme so enthusiastically, which has been very encouraging, but also the team who've delivered this incredible number of vaccinations. So over 78,000 doses of vaccines have been delivered since the beginning of the programme in December, and that is a phenomenal effort on behalf of the bailiwick. So I'm going to look at some more detailed figures in the vaccination programme, and one of the confusions that come in, people talk about whole population vaccination, but if you drill down on the figures, sometimes they're talking about the adult population, sometimes they're talking about the efficacy of the numbers uptake in the over 50s, and sometimes they're genuinely talking about everyone in the population. But starting off in the over 50s, we all know about the age-based morbidity and mortality associated with COVID-19. If you look at the over 50s, now 90% of our over 50s have had 2 doses of vaccine. So that's really, really encouraging. 97% have had at least 1 dose. So we're still catching up on those few people who were perhaps immunised later and still need their second dose. When people talk about whole population immunisation, what they're often referring to is over 18. So that is the target population that we're vaccinating at the moment. So if you look at our over 18s, 61% are now fully vaccinated, so have had 2 doses of vaccine, and 90% have had 1 dose. So again, extremely encouraging. With regard to the whole population, if we took all islanders, 71% of islanders have had at least 1 dose. So that progress of the vaccination programme is absolutely pivotal to our exit out of lockdown. So I want to just briefly talk about vaccine efficacy, and I presented some weeks ago to you about symptomatic infections and the efficacy of the vaccine in preventing a symptomatic infection. And what I showed you at that stage, and if you look at the first line, was a reduction in vaccine efficacy against symptomatic infection against the Delta virus. Now, as I'm sure you'll recall, that was a reason why we paused and said we want to wait until our population, our over 50s, are fully vaccinated. So if we then look at hospitalisation, that's more recent data that's come out. That's given us some very encouraging data. So if you look at the bottom line, dose 2 of the vaccine will prevent 94% of hospitalizations related to the Delta variant. So translated into numbers, that means that if you have 100 people, it'll prevent hospitalization in 94 of those 100 people. The remaining 6% will then have a risk of hospitalization based on their age. So I think that's really important. So 94% of hospitalizations are prevented by the second dose of vaccine. Now that's really important because a lot of our modelling is done to ensure that we don't breach our hospital capacity, and Dr. Raby will talk a little more about that later. So what I want to do now is give you some more details on our recent cases, and I've divided them into our second wave cases, and people have been particularly interested in how many fully vaccinated people have got infected. Now, in the second wave of infection, we know that at least one fully vaccinated person did become infected, and indeed they didn't transmit to anyone. So that was encouraging. Post-second wave, we've now had 12 cases. We've currently got 8 active cases. And if we look at them, and I've put the unvaccinated and partially vaccinated together, and I've put the double vaccinated people together. So if you look at the partially and unvaccinated cases, 8 of those were detected on day of arrival testing. So no change after the 1st of July. That group will still be tested as they come in because they're either partially or unvaccinated. So we would still detect them as we would normally. We had a day 7 in one case. Again, it was a partially vaccinated individual, no change. On the 1st of July, we would still detect that case. What we had in the partially unvaccinated cases, when we still had some Category 2 regions, we did have one Category 2 case that was negative on day of arrival and became symptomatic on day 4. Now, that person would still be able to travel as a Category 2 travel in categorization, but they were in the community potentially infectious between their negative day of arrival test and their positive day 4 test. So we have to accept that whatever we do, there's going to be an element of risk. So this is all about risk mitigation and not risk elimination. If we look at the double vaccinated cases, out of those 12, there are 2 double vaccinated cases. Both double vaccinated cases went to the UK and were probably involved in what we call a super spreading event where a number of people were infected. Both of them were notified that they'd been exposed, and actually, when we phoned one of them tested positive on the day of arrival, and when we spoke to that person, they said, we were about to phone you because we've been notified by the UK. So we actually would have picked up that case as well. The second person was related to the first double vaccinated person. That person tested negative on day of arrival and only subsequently tested positive. We'd identified them for follow-up testing. So what I'm trying to show you with this is there is no simple answer. Most of the cases that enter the bailiwick after the 1st of July will form part of our categorization because there'll be the unvaccinated and partially vaccinated cases, and there'll be no change in how we diagnose those cases. So as ever, it's trying to show people the evidence of what we're doing. So I think, again, going back to our favourite tipping point, and as we move on, we're seeing increasing protection from the vaccination. However, if you look at your NPIs, we don't want people to forget about NPIs. So things like hand washing, stay at home if you're unwell, mind people's personal space, that has to form part of our new normal. And as we move particularly towards the winter seasons where we could face a very serious flu season as well, we need to be really cognizant of those messages. So important that we take those messages and we don't forget about those. I've gone into several establishments and there'd be no hand sanitizer at the door. I'd encourage everyone to look at what you're doing. Use your hand sanitizer. Businesses to have hand sanitizers at the door. People not to go into work if they're unwell. So all of those messages of absolutely critical importance. Now, the other thing I wanted to talk to in our moving forward strategy is our testing. Now, I think I've shown you this before, so testing, and I won't go into sequencing, but we have the symptomatic surge and surveillance testing. So with the symptomatic testing, I'm going to highlight it in a bit more in the next slide, is we are broadening the symptoms in relation to the Delta testing and asking a different category of people to come forward for testing. More about that in a moment. But we retain our capacity to surge test. So if there's an area where we identify a case, we retain our capacity to be able to go and surge test. But with surveillance testing, we'll be doing testing on the borders with the categorisation. But I'd also like to highlight other aspects of our surveillance testing that people may be aren't so familiar with. For example, if someone has travelled outside the bailiwick and has come back in, and they've travelled outside the last 14 days and wants to go into an educational establishment or early learning centre or early years centre, whether it's a child or a member of staff, they have to have a negative test before returning to that educational early years setting. And that really forms a protection for the schools, for the early years setting. All of the teachers are on surveillance programs, so we've got huge amounts of surveillance going on. Last month, for example, we did 8,700 lateral flow tests, so a huge number of lateral flow tests, which forms part of our program to keep the bailiwick safe. So the surveillance testing doesn't only include the border testing, it includes the surveillance we're doing on various groups in the population, but also testing when we return to education, early learning, early years setting. So it forms part of the protection. So the other thing I wanted to highlight was the symptoms that we are looking at. So there have been reports, particularly from the Zoe app, I'm sure you've all heard about that, about slightly different symptom emphasis in relation to the Delta variant. Now, we know the Delta variant, we've seen a lot of cases in younger people, and what they're reporting through this system is that you're seeing quite a lot of cases of headache, runny nose, sore throats, really cold symptoms. So what we're highlighting to people is if you have those cold symptoms, you should come forward and be tested. One person said to me, but it's hay fever season. Yes, we know that. So if you normally get hay fever or you're allergic and you have a runny nose, you take your antihistamine and you feel a lot better, then I think that answers your question. It's the allergy. But if you feel that you have cold symptoms, we're asking people to come forward and be tested. We know that it'll mean that we'll be testing more symptomatic people. We think that's important because it's important to try and detect symptomatic people early. So what we also want to do today is discuss our new contact tracing program. Now, as we vaccinate an increasing number of people, we will be modifying our contact tracing program. Most importantly, if you have a fully vaccinated person who is a contact of a case, they will not be required to self-isolate. They'll go on a testing program. So they'll be contacted by the contact tracers and then go on to a testing program that is appropriate for their contact. That will usually mean a test immediately, a test on day 7 and a test on day 13. Just to remind you, fully vaccinated is not just having had the 2 jabs, it's 2 jabs plus 2 weeks. Now, the logic, scientific evidence for that is we know that fully vaccinated people are less likely to transmit and are more likely to have a lower viral load in their respiratory secretions. The other thing that I want to emphasize is if you're a fully vaccinated person and you've been in the United Kingdom and you're contacted either formally through their track and trace system or informally, saying by people, the event that you attended, saying that you've been in contact with the case, please contact public health, because that forms part of our protection that we provide for the island, because we can then risk assess it and decide whether further testing is required. And finally, just to remind people about the 3-step program. Step 1 is what we're progressing to on the 1st of July. Step 2, we'll be looking at possible modifications for bailiwick residents who are fully vaccinated, travelling outside the CTA. That'll be very much depend on what's happening outside and what's happening in the UK. And then finally, what we'd like to do is have a matching within the CTA for restriction-free travel with alignment with the UK traffic light system. So that's the 3-step program we're working for. How quickly we progress after step 1 is going to depend on events over the next few weeks. So thank you very much.
Thank you very much indeed, Dr. Brink. Now, one of the reasons that we took the steps that we did, or the Civil Contingency Authority took the steps that it did, was to prevent our hospital being overwhelmed, prevent it not being able to cope. And that's been a common theme throughout the last 15 months or so. We've only got one hospital. It's already a busy hospital. But, and you'll hear in just a second or two from Dr. Raby, The chances now, because of the vaccination programme and all the other information and procedures that we've got in place, of the hospital being overwhelmed by an outbreak of COVID are very low. The probability is very low. So Dr. Raby's going to explain that further.
Thank you. People have been, I think, worried that the hospital's been busy recently, and it has been, and it should be actually. We have at the moment about 15 to 20 patients who don't need to be in hospital, who we'd like to be able to discharge to a care home or back to the community. These are just normal pressures for us. So these are the sort of pressures that the nursing team live with every day. And so yes, the hospital's busy. But the point is we are ready, if we have to manage COVID. And we always have been. Not because of these changes that we're announcing, but because we've known throughout that COVID cases are going to arise in Guernsey, and that it's quite possible and quite likely that some people are going to need hospital treatment for that. So we've always been in a position to offer treatment for COVID, and we are in that position now. If a patient needs hospital with COVID now, our Brock Ward COVID unit is ready to be mobilised as soon as they need transferring into the hospital from the emergency department or from wherever they're coming. So we have the hospital set up to deal with COVID, and that's just part of living responsibly with this disease, as we live responsibly with so many other conditions and diseases. So the hospital's well placed to deal with any outbreak. And as I emphasise, we've known that COVID cases can arise even before we move to category travel, but certainly with category travel. So if I can make some points about this change, we don't believe that this change, the blue travel, puts our health services at increased risk, because double vaccinated people are, as you've just seen, well protected from COVID. Our staff have had the opportunity to be fully vaccinated as well. So we're running a hospital with highly vaccinated staff, and we've got a population with highly vaccinated people. And you've seen the figures that double vaccinated people have in the mid-90% reduced chance of hospitalization, even against modern variants of the disease. So our most vulnerable people in society are the most vaccinated. Those in the elderly group who we know had the worst outcomes from COVID, those with comorbidities, those are our best protected groups of people in Guernsey. And that's an important point from the hospital's point of view as well. We've kept throughout the pandemic a close eye on hospitalization rates worldwide and across the UK. We know what's happening with hospitalization rates in the UK as their rates go up. And actually, it's not overwhelming the hospitals, but we are in full awareness of what's going on there. We've modelled for outbreaks locally, and we've updated that modelling to look at the Delta variant of concern, and we know we took that modelling to the STAC, to the Scientific and Technical Advisory Committee, and we went through it in detail there. Now, the STAC isn't famous for agreeing with each other all the time, but on this issue, we were unanimously, everybody unanimously supported moving ahead with this blue travel category in light of the most recent modelling we've done on the Delta variant. So in short, we've known that we're going to get cases of COVID in Guernsey. We're ready for them, and we don't believe that this is a change that is of great significance to the hospital as it stands ready for COVID. The other thing I want to touch on is treatments for COVID, because I've not been with you for a while, and just to keep you informed and updated. We keep constantly under review the evidence about emerging and new treatments, as you know, and there's lots of drugs that are being observed and being tested and things. And just to let you know that the medical cell guidelines for managing COVID are kept up to date. They have been updated recently. One of the drugs that we were asked about here, actually, budesonide, has been strongly supported by evidence now, and that's just part of our normal management of COVID in the community. It prevents hospitalization. So there's things we can offer people in the community that reduce their chance of hospitalization. Treatments for COVID are much better than they were, and they continue to evolve, and we keep abreast of those developments. So in short, the hospital's ready for COVID as it has been. We're not worried about these changes. We think they're the right thing to do, and treatments, as I say, are continuing to develop and improve. Thank you.
Thank you very much indeed, Dr. Raby, for that advice and statement. And last and not least, I'll turn to our Chief Executive, Paul Whitfield, who'll tell us, because things will change. On the 1st of July, it could be different for the states of Guernsey, it will be different for us as citizens, it will be different for businesses. So, Mr. Whitfield, if you could take it.
Thank you, Deputy Fairbush. We've heard the phrase living responsibly with COVID a number of times today, so I'd like to spend a little time talking about what this actually means in practice. Hand washing, respiratory hygiene, staying at home if you're unwell, and reporting any symptoms are all essential parts of living responsibly with COVID. We should all have been doing this anyway. I feel Dr. Brink has said it enough times for us to be seared onto all our brains, and it really must be considered a part of our new normal. Positively, the excellent rollout of the vaccination programme will mean the likelihood of a third lockdown is very low. But living responsibly with COVID is not just about the vaccine. There are other things we need to do and need to prepare for. As noted by Deputy Soulsby, it is important for us to understand this would be the case no matter when we relaxed our border restrictions, whether it was July the 1st, August, September, or indeed even next year. The timing of our next step doesn't change what we'll need to do in terms of living responsibly with COVID. And what is that? Well, first we need to be thinking about how it is we will live in the bailiwick with COVID as an endemic rather than a pandemic virus. What are our proportionate measures for our businesses so that they can be confident their operations won't be disrupted and have the contingencies they need for if and when they need them? This year and last year have demonstrated that our community can react quickly to change. We need to reflect on our experiences, the challenges we face, and learn from them. From a government perspective, as an organisation, we'll be reassessing our business continuity plans in light of the experience of over the last 18 months. We now have the technology across all organisation that allows us to work much more flexibly. We will insist and be supportive that staff stay at home if they are unwell. We will also request COVID testing for those showing symptoms, however mild. Dr. Brink has covered what will happen if a fully vaccinated person is contact traced, but there may be some specific work-based restrictions in those cases if the person works, for example, in the hospital or, say, care home settings. It would be too much detail to cover today, but our officers are working on guidance for business sectors, so next week we can make available more bespoke advice for the sorts of things each industry sector might consider. But ultimately, as I know many of you have already started to do so, businesses need to think about this themselves too. After all, you know your businesses and requirements better than we do. Look at your business continuity plans. How would your business cope if a key member of staff tested positive for COVID? What about your unvaccinated staff? What would happen if they were identified as a contact and had to be isolated? Are you able to split teams and build resilience and cover to keep your businesses going? We know the symptoms have been updated to reflect the Delta variant, and we will see more children whose schools will correctly ask them to be tested because they have a runny nose, a sore throat, and possibly headaches. For businesses, this may impact the parents who work for you. Be ready for that. There may be days they need to take their child for a test at very short notice. All businesses should continue enforcing hand hygiene for staff and visitors alike. I know the catch it, bin it, kill it mantra, hand hygiene and staying at home message make me sound like a stuck record. But these simple measures will not only help us reduce the transmission of COVID, it is good practice for many other viruses that can make us all poorly. For example, when entering a shop or a restaurant that proactively provides hand sanitizer, and we continue to encourage all businesses to do so, do you consciously use the facility or simply walk on by? This is all our part to play in living responsibly with COVID. Indeed, we continue to work together. If you're organising a large event, take a look at the event advice online. It's all good practice. Remind people attending to be vigilant for their own symptoms. Indeed, if you feel unwell, specifically runny nose, sore throats or headaches, avoid attending, stay at home and book a test. And what does living responsibly look like in our own homes? Well, all the same rules apply. Be vigilant for symptoms and get tested if anyone in the household has COVID symptoms. however mild. Please stay away from workplaces, education and social settings if you are unwell. You may need to think about what support you would need if a member of your household tested positive for COVID and had to isolate away from other members of your household who aren't fully vaccinated. You would need to think how you would ensure you had the necessary medication, food and groceries for those in isolation. To those who are preparing to travel, maybe for the first time since the pandemic began, travelling has changed. We do have more requirements. Even fully vaccinated Blue Channel travellers are required to fill out the online travel tracker and provide all the details requested. Getting through our airport and port will take longer because of these checks and because many arrivals will still be required to take a test. Be ready for that. Plan ahead and accept it will take longer to pass through our ports. Please be patient with the staff of the ports. They are only there to assist you. As mentioned, we are likely to have more cases in the island. Again, the probability of a third lockdown is low. However, it's possible that we might need to reintroduce non-pharmaceutical interventions for limited periods from time to time. For example, intermittent use of face coverings or social distancing whilst an outbreak is managed, for example. In light that we may have more cases on Ireland, we also need to accept and respect the fact some in our community may take precautions that make them feel more comfortable, such as wearing face coverings when in a crowded space, for their own peace of mind. A face covering should not be seen as something odd. We continue to be kind and respectful, and it's a personal choice. Living responsibly with COVID will not mean going back to the world before the pandemic. We can never go back, but we can positively move forward together. Thank you.
Very much indeed. And just picking up on that point, life will be different. But border restrictions were never meant to be permanent. They cannot be permanent. We have to live as human beings. We have to develop. We have to encourage people and protect people's mental health. We have to, as a society, advance as other societies are. But we're doing so, as has been evident from the 4 able colleagues that I have here, in a considered and balanced way. Now, there's one other thing I want to mention before we turn to questions, and that's the VaccineAid fundraising campaign. Our Overseas Aid and Development Commission are supporting UNICEF. Now, they've set up a crowdfunding page where islanders can make their own donation to the global drive to provide vaccines to low and middle income countries. Again, typical of the bailiwick of Guernsey, in less than 2 weeks, islanders have raised more than £14,000. Thank everybody for their donations, and the place to donate is vaccineaid.org/Guernsey. I'll repeat that, vaccineaid.org/Guernsey. Thank you very much, everybody. Ladies and gentlemen of the press, your questions, please. Juliet.
Good afternoon, panel. Juliet Poutet from the Guernsey Press. Thank you very much for your update on, obviously, schools. I know that it's in the forefront of many people's minds about the possibly, not the risks we're putting young people at, but obviously they aren't vaccinated yet. I just want to check, are we vaccinating 16 and 17-year-olds yet as part of the full vaccine programme? And when are you predicting that we're hopefully going to start vaccinating over 12s? Because I know the UK is sort of moving in that direction. Do you have an idea of timescale?
So currently our programme is 18 years and over. What we're doing is waiting for final guidance from JCVI with regard to the vaccination of the under 18s. So we need to wait and see what the recommendations from JCVI are. Throughout the programme, we've followed their recommendations.
I don't think they're vaccinating
time at all.
Sorry,
have you had any indication of a timescale?
I think those are due imminently, but I don't have a precise time. But my understanding is that they're due soon, and we'd use those to then plan any programme over the next months. But we need to wait and see what the JCVI recommendations are. So
would you possibly be hopeful that we might be able to maybe start vaccinating under 18s in the autumn, for example?
It depends what the recommendations are. As soon as we have the recommendations, what we'd do is look at how we'd implement them. But yes, we're planning for booster. We're planning for a number of scenarios. We're planning for a booster program, how we deliver a booster program, if we had to extend the program. So we've got a number of plans in place. We just need to wait for that final guidance before we can firm those up.
So we're not out of kilter with the UK at all, are we? We're going in. We'll be moving in step with the UK. That's what we're being told. I don't blame the questioner for trying to press for an answer for a specific time, but as Dr. Brink explained, that can't be given yet. Yes?
Matthew Leach, the Bailiwick Express. If we're ready to live with COVID, why are we only opening up to the CTA as a blue channel at the moment, as opposed to the rest of the world?
I think we'll ask Dr. Breen to go first, but then I'll comment afterwards.
Yeah. So it's all about doing this in an incremental fashion. We need to take the first step and, as ever, look at the evidence, look at the impact before we take a step further. Also, within the CTA, we have the ability to certify vaccination status. So it's a combination of the ability to certify vaccine status, and I'm sure Mr. Whitfield can say more about that, but also doing this in an incremental fashion. So putting one extension in place at a time.
Yeah, and that's the point. It's taking a gradual step, step by step. This is the first step. It is a big step, but it's a step that's balanced. Do you want to add anything?
Well, just that there is more work involved in moving to that second step, as Dr. Brink has said, and I think Mr. Whitfield might add to it in terms of the certification that is now understood and amongst the CTA means it's something we can bring in now. There's more work to determine, well, how do you certify somebody having a vaccination in another country and what does it mean and can we rely on it? So there's more work behind it as well.
Next question.
John Valentis from BBC Guernsey. It's one for Peter Raby, if that's all right. If you are a care home staff or someone who works at the hospital and you come back from the common travel area after being double jabbed, so you're able to travel without restrictions, will you need to do anything before you go back to work? Obviously, if you're not showing any symptoms, you're completely fine. What may you need to do? Would you need to take a test?
Good question. What we're saying is if you work in the Princess Elizabeth Hospital or the MMH, and you've come back and you're double vaccinated, so you come through the blue channel, and you are patient-facing, then you are going to be tested. And that's part of what we're using our testing capacity for. So we will test you on day 1, and we'll test you again on day 5. And if you're not patient-facing, or if you're not in an area where you're working closely with people who might be vulnerable, then we're not insisting on a test for those people.
Super, thanks.
Any other question?
Juliet from the press. I've just got a question about the Pfizer vaccine. I've seen a number of UK publications publicly reporting that there's been some shortages of Pfizer in the UK in a number of areas. Are we being impacted by that at all, and does it concern you?
So, no, we're not. We haven't had any impact. I haven't had any signal concern raised to me. So at the moment, no, we're not being impacted.
Why was the bracket of 12 to 17 chosen for border testing? What's the difference between a 12-year-old and an 11-year-old, for example?
So it's simply related to a 12-year-old and the ability to self-sample. So it's related to movement through the borders. And then, so what we then did is we've designed the children programme as a single entity. So not only do you have the testing at the borders for 12 to 17-year-olds, but then you also have that testing within 48 hours of returning into the school environment. So we don't consider risk in a singular way. We look at multiple ways in which we can address any potential risk.
Okay.
Dr. Brink might correct me here, but I think one of the reasons why we're doing it for that group is because they have one of the highest infection rates linked through to that. So we wanted to protect them.
Yeah. So again, Deputy Soulsby is absolutely right. Thank you for reminding me. The groups that have been most affected by the Delta variant are the 10 to 19 and the 20 to 29-year-olds. So it's a group that's been most affected.
Louisa Britton from Channel TV. When you go into step 2, will there be plans for having an agreement maybe with the UK for people kind of transiting through the UK who are double vaccinated, or is that currently something that you're looking at so they don't need to self-isolate in a hotel in the UK?
So I think the red travel areas, we'd always want to align with the UK on that. The others, what we need to do is we want to implement step 1. So over the next 2 weeks, we'll be not only monitoring the impact of step 1, but we're looking very closely at what step 2 means. So we need to do further work on that before I can give you a definitive answer.
Probably one for you, Deputy Fairbrush. It's quite a niche example as well. Been sent an example, the Catel PTA fair is being held inside and they've cancelled it because of guidance from public health. And as far as I was aware, there were no restrictions on Ireland. Is this a case of some places being told, yeah, we can't do this inside, maybe your building isn't small enough, or is that erroneous?
Well, I didn't know that specific case, but I fully accept what you say. But in relation to that, if they've sought public health guidance, then they've presumably acting on the guidance they've received. There are no rules. It's the common sense. It's the general point that's been made by everybody that's spoken today. we've got to act responsibly. The world has changed. There are certain things that we can't do going forward that we would have done in the past. But the idea is, over a period of time, and as I say, next week's the first step, is to get back to as much normality as is possible. Do you want to add anything?
Well, only that we don't know any details about that. I think it's probably something for public health. If that is what they have said. I mean, I've known over the last few months public health have been accused of closing things, which hasn't been the case. But if their recommendation is not to do something, then that should be followed. But Dr. Brink may know more than that.
May I suggest that they contact us and we make sure that this is something that's been advised specifically by public health services. So whoever's arranging the fair would be very happy for them to contact us.
Very niche, sorry.
Thank you.
When you first announced the Blue Channel, you did warn us that obviously if there was a high number of cases in certain areas or a number of variants, you may introduce more restrictions. I think it's fair to say there's parts of the UK where there's currently a very high number of cases and they are seeing various kinds of variants they're trying to contend with. Do you expect to possibly introduce more restrictions even for vaccinated individuals if the situation continues to get worse in the UK?
That's always possible, and we'll look at the evidence as it emerges. One of the things I think the pandemic has taught us is that we can never say this is exactly what we're going to do for the next month, because we need to assess evidence as it appears. So we will keep looking at evidence, we'll keep looking at any emergence of variants. One of the things that would concern me was the emergence of a variant that has a vaccine efficacy reduced even further than what we've seen with some of the Delta variants. So I think that's really important.
Oh yeah, just kind of off the back of that, previously you kind of talked about your sequencing capacity. Is there an update on that?
Yeah, so that is being built at the moment. So we're hoping to have that operational towards the end of July. So that's always been our target with regard to that. At the moment, we're sending our samples that we have to be sequenced in the UK. I think what we've got to realise is that with some vaccinated individuals, you have such a low level of virus, which has been with one of our cases, that you can't sequence it because there's too little virus there. Well, that in a way is encouraging because that person's less likely to transmit. So we're not always going to get sequence data on every single case.
For Deputy Fairbrush, I think this one. A bit controversially, the former chairman of the CCA has come up publicly saying this policy is a mistake and it should be delayed by a month. What's the official response from the CCA to that?
I'm going to ask my colleague Deputy Salisbury to do it.
Yeah, I mean, as I said in what I said in my speech, I've been there from the start as well. We're following the evidence as we've always done from the start. So if we're doing it wrong, if that's the idea, then we're for the first time going against the views and recommendations of our experts, which is rather strange. And of course, it's easy to say, because we're doing something positive here, that, well, look, it's too early, and if I would do it, it would be later, because you're in a no-lose situation there. Because if we're right, it will be forgotten about. If we're wrong, well, then you can say, I told you so. Is exactly what I was saying earlier. All we're saying is we are following the evidence in the same way we did from the very beginning. And I think that's why people should have that comfort. It's not just a policy. Everything's been a political decision from day one. But we've listened to and followed the evidence. And as Dr. Raby just said, the Scientific Technical Advisory Cell are unanimous on this. And they haven't been throughout all this. And there have been challenges we've had throughout the whole of this pandemic. Not quite sure we've done it right. Are we going too soon? Are we going too slowly? In this case, there is unanimous view that this is a time we can go. And I've gone into the detail about, we're leaving it a few weeks. It's not going to make that difference at all. And I think one thing, I don't Dr. Brink would talk about, people say, well, we should leave it till August when everybody is vaccinated. But there are issues around doing it that late, aren't they, Dr. Brink?
Absolutely. And if you think about it, over the summer, it's where everyone's likely to be outdoors. The children won't be at school. But also what we're expecting to see towards the end of this year is possibly another wave of COVID as well as our flu season. So we can continue to say to people, well, we're not going to do it, we're going to delay it for another month. But one of the GPs on the stack said to us some months ago, we have to consider the wider health and well-being of the population as well as the specific risk posed by COVID. And that wider mental health and well-being is so important. And we can't become too focused on the very narrow health protection risk of COVID and actually forget about everything that is affecting the wider health and well-being. And I think at this point I'd also like to pay testament to the students again, because I have a group of students that contact me at regular times, and obviously we've been concerned about the impact on students, and one of them contacted me and said, for goodness sake, we can see the broader picture, we can see the bigger picture. And so that support that we've had throughout this pandemic from our student population must be acknowledged. They have been absolutely exceptional, and from a public health perspective we'd definitely like to acknowledge that.
Thank you very much indeed. Juliet, and then you, John.
I understand that our tourist establishments are very busy this summer, with a lot of people obviously keen to come in and obviously visit after such a long time away. But we have had a local establishment get in touch with us who say he's deeply concerned that, for example, if you come in, a family comes in with their children, for example, and on arrival, one of those children tests positive. They've planned to come over for a week, so they go to their accommodation and they obviously self-isolate responsibly. But if they've only got that accommodation booked for a week, and that accommodation is booked for someone else at the end of that week, and they've got nowhere to move on to, but they're still having to self-isolate, what sort of recommendations can you give to people in this sort of situation? Because it must be in the back of most parents' minds if they're travelling that this is going to possibly cause some problems.
I think, Paul, if you could perhaps... Yeah.
Of course, it's a difficult call, because we've always said that we would review the situation every 2 weeks, and also said that it is a bit of a moving feast. So in terms of the start point as a family and in travelling with children, there is an element of risk. I think all members of the panel have emphasised, and with that element of risk, there's a question of personal judgment. If you're only coming here, say, for a long weekend because there's a family event, there is a likelihood such a thing could happen to you. And do you take that step to bring the whole family? These are difficult decisions, but I think everybody, and probably all those sitting on the panel, have the same issues with families. They are difficult decisions.
But also, at the same time, you go off on holiday. It's nothing that doesn't mean that you eat something dodgy. It means that you have to stay in your hotel room for another few days, and you have to ask, well, we can't particularly move. I know that personally from quite a while ago now, but that does happen. So those things can be taken account, but on the basis that we won't be flooded with people who need to self-isolate on that basis. And clearly people before they travel need to take that risk consider that into account.
Any other questions? Yes, Louisa, then you, John.
Oh, yeah. Just a quick question about kind of the flu season. Are you particularly concerned that we might be having maybe a bad flu season this year because of not having many contagions earlier on?
So I think that's a very good point, and the answer is yes, there is a potential for a bad flu season. The reason for that is that we saw very little flu last year because the population was essentially not moving globally, and so what you'll see this year is there's not much innate immunity within the population. And the other thing is, I'm sure you're aware, is that the flu vaccine is matched on the previous year's flu isolates, and so they're having to match it going back 2 years now, and so it's difficult to design what will be an optimal vaccine. We're hoping that the vaccine will be optimal, but there's been a challenge to design the right vaccine, number one, and number two, it's likely that our population will have lost that innate immunity, so we could have both COVID and flu this winter, and this forms part of our planning. So in round about July we start planning for winter. I know that sounds really early because people are in the middle of their summer holidays, but it's when Dr. Raby and I start talking about how we're going to manage the winter season. So we're talking about the flu vaccination programme, there's probably going to be a COVID booster programme, but also how we keep the population healthy with the other measures that we'd like to see in place over the winter. So yes, we could have a challenging winter.
John.
I mean, just to follow on the back of that, it's the COVID booster programme, something I'm quite interested in. Is there any idea of timescale on that? Because
not yet. So
people's
again,
second doses, I'm just wondering how long until it's needed.
Sorry,
no.
I interrupted you. I beg your pardon. Not yet. But again, it's something that we're expecting advice on imminently. But we're planning as if we're going to have a COVID booster programme. So we're putting that planning in place to deliver that programme.
And will that that still be distributed at the mass vaccination centre here at Beausejour, or is it going to be something more GP-based?
Well, we're going to be looking.
We're looking at a variety
we
of
can't
models.
tie up Beausejour forever, so there are other venues that will be considered.
Any idea of what they are?
Julietta, then Matthew.
I think throughout this pandemic, the Guernsey Together spirit's been one thing that's been really important to the panel, because it means you very much had the public, most of the public behind you throughout all of this. I think it's fair to say that obviously the 1st of July has been a very divisive issue. I think we did a survey yesterday and we found it's very much split. People feel very strongly either for that it's the right thing to do, or they feel very much against. I mean, does it concern you? Obviously, this has proved to be quite a divisive point. And do you think there's any way we can try and bring the community back together?
I'd say this was always going to be the hardest decision we had to make. We knew that from day one. It was very different when we were saying we're going into lockdown. People felt that it gave them that security and safety, but after seeing everything that was going on in the world, which was frightening, and we saw hospitals in Italy being overrun, and we felt very much exposed to what was going on. It gave us that safety blanket, as did what we were doing with the borders. So as we're moving out of that, for the first time in 15 months, opening our borders in this way, I absolutely understand why people will be afraid of that. But what we're trying to say, what we're doing, as we've done from day one, is to look at the evidence and know that we're taking. The risks are not increased by what we're doing. We're doing this in a calculated, measured way, as we've always done, listening to the experts as we've always done. And so that's all my appeal is for people. Just trust us, who trust the experts, who use the data and the quality data wisely.
And that's the point. It is a very, very difficult decision. And as I said at the very beginning, when we began this broadcast and this press briefing, we fully accept and take account of the views of everybody. And you're absolutely right. There are strong divisions, but we've listened to the evidence. If the evidence was different, we wouldn't be making the decision that we've made. We wouldn't be opening up in the way that we are on the 1st of July. I think, Matthew, you've got a question.
With the University of Oxford trialling ivermectin, is this now being seriously considered as an alternative to the vaccine?
Yeah. The answer is it's been being observed for a long time because it's been of interest in various places throughout. It still hasn't got the high quality evidence that would encourage NICE or the NIH to say use ivermectin. So the answer is it's not recommended for use locally. It's not recommended for use by NICE or the NIH. But this study that Oxford University are doing on it is a really high quality study. And obviously, it's being taken seriously to get that far with the Oxford University study. So we'll await the results of that, and I think they'll tell us one way or the other for sure.
Yeah, anybody else say bye? Because we're coming up for 2:00. Yeah.
So only a very brief question. One of the reasons the importance of having a very high vaccine rate was in case people could not be vaccinated for some reason. For example, if they were allergic to it or they had some sort of other condition. However, I'm aware of quite a few people who've possibly immunocompromised in various ways who've fortunately been able to have the vaccine. We've also got 3 vaccines now. Do you have any idea of how many people there are in Guernsey who, for medical reasons, cannot have it? Is it a relatively small number?
Yeah, it will be a relatively small number. And the point that I'd like to make is that there are people who have an absolute contraindication for the vaccine. There are people who have a self-declared contraindication for the vaccine, and we need to differentiate between the two. So some people feel that they shouldn't get one or another vaccine, and what we're saying is that if you don't have a documented contraindication, is we'll look at people who want to choose a specific vaccine at the end if we have sufficient vaccine over. What we can't do is allocate vaccination to a group who don't have a specific contraindication. The point I'd also like to make, if you've got a contraindication for one dose of vaccine, for example, anaphylaxis, for one type of vaccine, for example, anaphylaxis, you won't necessarily have a contraindication for one of the others. So anyone who's been told that they've got a contraindication, I'd advise to discuss with their GP to see whether they've got a genuine contraindication or is it to one specific vaccine where they could then have an alternative. But it has to be a contraindication according to the MHRA guidelines.
Okay, I think one final question.
This is a question for Deputy Fairbrush or possibly Deputy Soulsby. Is there a concern from the panel that you may be creating a bit of a divide between older people and younger people for the fact that now there's this new thing we've heard about that if you are unvaccinated, you may have to isolate if your contact traces, but if you are double jabbed, you won't have to isolate, and that will go on for a few months until the entire population is jabbed.
The intent is, I'll turn to Deputy Salisbury in a moment. The intent is no. The intent is to be fair to everybody, to take into account the interests of everybody. That doesn't mean you can all move at the same pace for obvious reasons. The reason that the older people were vaccinated first was because they were the most vulnerable. They were the ones who could occupy hospital space. They were the ones whose health was most at risk. But of course, we accept that that goes across the whole board.
I think also, if I might just jump in there, I think we think about where we are today, we forget where we were when we came into this and we had no vaccination, we had very little experience, but actually we knew that our older population were exceptionally vulnerable and they had self-imposed constraints on staying in, not going out because of the extent of vulnerability. We hope to be in a really good place by mid-August. We're only weeks off to where we are with one of our major targets in terms of vaccination. So this isn't a forever situation.
I would just add there's always been those inconsistencies throughout everything we've done. Some people have been able to go to work, some people haven't. Some shops have been open and some haven't. But we're not finished. We're not through this yet. And ultimately, we will be getting rid of all these restrictions and the difference between a vaccinated and unvaccinated person who goes through our borders. We're not yet there. We're just asking for a bit of patience before we do.
Thank you all for your questions today. Thank the people for watching and listening. We're moving forward. We're doing so. But again, our overwhelming concerns are the safety of the people of the bailiwick and moving forward in the most responsible way. Thank you very much.